We're a disability support service, and we started in 2017 with a focus on valuing disability support workers so that they can go out and provide great support to people with disability.
Working in somebody's home is a real privilege. We're really blessed that these folks let us into their homes, and that is also our work environment at the same time. So addressing that with open, honest communication is really important, I think. Just having the conversation that includes safety for everybody, and I think everyone's real open to that.
The approach to WHS at Includa is a simplified approach. We try and make things easy for our workers as well as the people we support. It's a consultative process where the worker has an input, the participant has an input, and all together we come up with a plan to make sure that everyone remains safe.
Inherently, homes have a lot of risks involved. There are things like our kitchens, there are things like slips, trips and falls, there's hot stuff, there's electricity. Some folks have equipment needs that our staff need to be trained in, like how to use a hoist, like how to transfer someone safely into a shower chair. And to understand those things, we need to work with people with disability to learn how they want to be supported and how to do that in the safest way possible.
So the risk assessment focuses on the hazards that are in the workplace, but it's also around identifying what the risks for the person that we support might be. It could be vulnerability if they don't have many connections in community. It could be health hazards that they have that we need to be aware of and make sure that our workers are trained to support them. Probably one of the most common hazards that our workers come across is the hazard of being isolated, so being a lone worker. One way that we try and manage those hazards is to stay connected with our workers. We have what we call the mentor team, and they're there to have a debrief, a conversation, and they come from counselling and other backgrounds to make sure that our workers are really getting heard and really getting that chance to debrief and share their experiences.
All the support workers at Includa have a tablet that has GPS tracking, so Includa can see where we are and what's happening. We can communicate immediately through that tablet if there's anything that we need. Anything that comes up in terms of incidences or safety concerns. On that tablet is also going to be risk assessments, safety plans, information about participants. We also have 24-hour phone support that we can call through for something needs to be addressed immediately.
If there's an incident, part of our incident follow-up is to actually call the participant or the nominee and talk through that. Understand what might have went wrong, understand how we can improve things and move forward together. Rather than just do those things internally, we want to involve people with disability and their families in how to best provide safe support.
We have what we call the Safe Support Committee, which is a group of our support workers, and we meet to discuss what challenges our workers are facing out in the workplace. And they recently added a consultancy group with people with disability who give us their perspective on what risk might be when they're receiving support.
The tools that we've put in place to help better understand risk and provide safe support, they make sense and they're not too cumbersome. They don't get in the way of people providing great support.
Advice I'd offer to other providers delivering support for people in their homes is to make work, health and safety easy. We do this by making sure we remain engaged with our support workers, that the tools that our workers have are accessible via their devices. Making sure our policies are easy to read is really important.
Take work health and safety seriously. It's worth taking the extra bit of time to look at each task and think, how can I do this safely?
It's important for businesses in our industry to have good work health and safety practices because we provide support to people who are the most vulnerable in our communities. Having good practices helps to ensure that the people we support remain safe, helps to ensure that people that provide that support remain safe.
So often I think this sector has used safety and risk as a reason to say no to people with disability. We want to use safety and risk as a reason to ask how. We want to provide support to people that includes risk because all big lives involve risk, but we just want to help people to do that in the safest way possible.